Dehydration is something that's going to happen to all of us. Dehydration is when we take in less fluid than what we're excreting. It's much more common and can be much more of a serious issue when we're on chemotherapy, we're taking medications, we're having other external issues affect our body, affect our habits. We sleep too long, we don't drink enough water, we don't eat enough food, we can get dehydrated. There are many causes for dehydration. It can be just that you forget to drink. It can be that taste is altered, which happens with some of our therapies for cancer. You don't feel like water tastes the same. It feels uncomfortable. It feels too hot. It feels too cold. Adjusting that temperature can make a difference. It can be just the taste or the feel of water. It can be that you physically can't take in water because of nausea. If you drink water, then it causes uncontrolled vomiting. And the nausea medications sometimes help with this. Sometimes it's difficult. Symptoms of dehydration can be anything from very minor to much more serious. Symptoms might include a headache. It might include some altered mental status or not thinking as clearly as you normally do. It can be that you don't have as much energy. It can be where you begin to vomit to the point that you can't keep any fluids in, and it comes to the point that you need IV fluids. So what can a patient do? What can you or I do to prevent dehydration? One of them is to keep a journal. And those of you that have worked with me know that that's one of the main requests that I have is keep a journal. If we're working on a certain symptom, I like you to journal towards that symptom, especially with dehydration. If you can keep in 2,000 cc's or 2 liters, 2 quarts of water a day, it's much more likely that you won't suffer from dehydration. The other thing we need to take into account is how much are you losing? A patient that's on a medication that causes severe diarrhea, you still need your 2,000 cc's, but then you need to make up roughly how much you're losing with diarrhea or frequent urination or having fevers. All of these cause an increased loss in fluids. So one of the things that really helps when I talk about how to prevent or how to treat dehydration is to write down a goal and throughout the day, take small sips. Keep track of how much fluid you keep in. If you're unable to keep in that amount of fluid for whatever reason, it may be time to consider IV fluids. It's always better to drink those fluids, eat regular foods, than it is to get frequent IV fluids. Many times with different medications, the feeling, the texture of drinking water, it gets altered and people just feel like they can't drink water. You can always flavor it. One thing to remember is that caffeinated drinks are going to cause a diuresis or cause a loss of fluid about equal to the amount of fluid that they drink. Another way to keep fluids in is to eat fluid-rich foods, watermelon, peaches, applesauce. Think of all the water-rich foods that may taste better, feel better. Always remember temperature. That's another way to get fluids in. Maybe it's at room temperature. It's without ice. Maybe it's nectars. You can drink that with juices. You can get that with fruits, vegetables. There are a lot of different ways that you can get fluids in to help prevent or treat dehydration. Remember that with dehydration, if it gets severe, you get to a point where you can't make up that difference, and it's time for IV fluids. It might be a headache. It might be nausea that's out of control. It could be that you feel very weak or you feel that your blood pressure is very low. Those are times when it's time to get in and get some IV fluids. Or call your doctor, call your practitioner and ask.